We can go to the next question, round 2. The brands Cremagel L and Anoblis each contain, these are local application brands, each contain a calcium channel blocker and lignocaine. These are used for what? Fissures or hemorrhoids? Fissures or piles? Anoblis, what a wonderful name. Sorry. Anal fissure is the correct answer. We'll discuss that. Next, please.
Is everybody on? I hear some people saying I'm not able to get it.
क्या हुआ?
Just try to log in again if you can.
Slow हो रहा है. It got started. Okay. So you missed the first question? Okay, good. I know good मतलब ऐसा नहीं good, but I know that you missed it. Good. Okay, next please.
I can show the question again, but I don't think you will be graded for that.
Next please.
Shall we go to the next one?
Yes. In which infection is azithromycin used up to a maximum of 500 milligrams twice a day for 5 days at least? High dose of azithromycin, 1000 milligram per day maximum, PID or enteric fever. This section is on antibiotics now, starting from this question. As most of you have guessed, it is enteric fever. That's right. क्या हुआ? गड़बड़ हुआ? Next please. 5 days. 5 days is the key. 5 दिन है ये. Next please. Which 3 drugs are approved for use in uncomplicated cystitis in a non-pregnant female? क्या हुआ? हाँ आएगा. We have given wrong? Enteric fever is the right answer. We will. Acha, they are getting wrong answer and they are this. Okay. So 80% will get a -1 mark unnecessarily. ऐसा है? समझ गया. So basically, this particular software is being tried also actually as a trial because we want to use it in QED. QED is that Juxtamed quiz that we will conduct on the 13th and 20th of October. And I wanted to know how this works so that we can. You will have to add? +5 I'll add to everybody. बट जो PID लिखे हैं ना उनको प्लस मिलेगा ना ज़्यादा. ओके नेक्स्ट प्लीज. अच्छा क्या हुआ? ठीक है, वी आर ओके. कैन वी करेक्ट द आंसर हियर और नो? वी कांट करेक्ट नाउ. नो, ये खत्म हो गया. ओके ठीक है. Which 3 drugs are approved for uncomplicated cystitis in non-pregnant females? Amoxicillin, cefixime, ciprofloxacin or nitrofurantoin, fosfomycin, cotrimoxazole. Which 3 drugs are approved? Okay, अभी कैसा है? ठीक है? Okay, great. Next please. Sorry. What are the drugs useful in atypical pneumonia? Doxycycline, azithromycin, levofloxacin, or cefixime, amoxicillin, linezolid. Atypical pneumonia means mycoplasma, legionella, chlamydia are atypicals. Again, most of you got that right. Next, please. Okay, moving too fast मतलब आंसर एक बार दिख गया तो आपको क्या करना है? मैं हूं ना इधर. नेक्स्ट में अपन सब डिस्कस करेंगे. If you are, I should not interrupt your Answering. What are the drugs useful in anaerobic infections? Metroclindamoxy or ciproclariterosefixime? Okay, oh wow, 94% got that right. Wonderful. अभी इतना ही स्लो चलेंगे, सबको अच्छा मिल रहा है. According to WHO, antimicrobial resistance causes an estimated 5 lakhs deaths, 5 lakh deaths per annum globally, or 50 lakhs. मतलब 500,000 or 5 million deaths every year globally due to AMR. Now this will tell me how many of you are optimistic and how many are pessimistic. Yeah, equal numbers, but 50 lakhs is a number, unfortunately. Next, please. Which oral antibiotics may be used to treat skin and soft tissue infections caused by methicillin resistant Staph aureus? Which oral antibiotics may be used? Toxicodromoxazole, linezolid, clindamycin, or amoxiclav, cefuroxime, moxifloxacin? Okay. We have 245. I thought we had less. Can somebody outside access this?
So if they are on your group, they would be able to access it.
Okay. Okay, you got that right. Again, majority of you is the correct answer. Next, please. Next, please. नहीं आ रहा है? Okay, coming up. Which two of these oral drugs are second generation cephalosporins? Correct answer is cefuroxime, cefprozil are second generation. Next, please. Which anti-inflammatory drug has received approval for secondary prevention of atherosclerotic cardiovascular disease in patients with HSCRP of 2 or more? Once daily azithromycin or once daily colchicine? Secondary prevention of ASCVD. Colchicine is the correct answer. Next, please. (2.5 milligram BD orally, starting 12 to 24 hours after surgery and continuing for 10 to 14 days if TKR, or 30 to 38 days if THR, is the dose of which drug? Apixaban or warfarin? Is correct. Next, please. Apixaban 10 BD for the first 7 days, then 5 BD for 3 to 6 months is the treatment for what? Uncomplicated DVT or stroke prevention in atrial fibrillation? This might be a little confusing, so I'm expecting a 50-50. Almost. Uncomplicated DVT is the correct answer. Next, please. I will come to that. In a patient receiving bempedoic, chlorthalidone and low dose aspirin may suffer from thrombocytopenia or hyperuricemia as a cumulative side effect. ADR is adverse drug reaction. The correct answer is hyperuricemia. Most of you got that right. Next, please. Second last question of this session. ARNI, beta blockers, SGLT2 and MRA are the 4 pharmacotherapy pillars for what? Heart failure or chronic stable angina? ARNI, angiotensin receptor neprilysin inhibitors, SGLT2, sodium glucose cotransporter 2 inhibitors, MRA, mineralocorticoid receptor antagonists. Heart failure, most of you got that right. Next, please. And the last question. Cilostazol, pentoxifile, and aspirin and statins are considered useful in TIAs or intermittent claudication. The correct answer is claudication.
So next we will be showing the scores only for round 2, and after that we'll show the combined final scoreboard.
And the combined final will be ranked wise
It
or
will be ranked wise,
So
yes.
let's see the scores for this
For
particular 14 questions.
And again, these
Again,
are
alphabetical.
alphabetical.
So, so there is a small overlap between the first half and the second half. I don't see a significant overlap. I think I saw Sushil Shah there. And who else did we see there? Nobody else? Okay, so that's exciting. Let's now go to the top scorers.
You want to go to the next slide? So
Yeah,
the final board, and then you will be discussing.
Then I'll discuss the rest so that the suspense is not too long. Tushar Maniar wins the quiz.
This is Tushar Shah.
Okay.
This is Tushar Maniar.
Sushil Shah and Sachin are equal. Sheila Rathod, Neha Shah are equal. Leena Bhagat, Mukesh Bhambre.
So when, so the scoring, Tushar, the scoring goes like if the points are same, there is a total time taken to attempt. So that person gets the higher rank.
Yeah, we may have had some problem with a couple of questions, so pardon that. But otherwise, this looks like the leaderboard. Maybe we give a big round of applause for all of them. So, Dr. Sushil Shah, Sachin, I forgot your surname. Whereas, can you please, all 10 of you stand up in your seats so that we know.
Dr. Sushil Shah, Dr. Sachin Parchure, Dr. Sheetal Rathod, Dr. Neha Shah, and Dr. Leena Bhagat.
And the other 5 also, please. All of you stand, please. Dr.
Mukesh Bhambre, Dr. Mala Mange, Dr. Sunita Manglik, Dr. Jehan Cooper, and Dr. Hitesh Dubaria.
All of you are standing because we need photographs. Again, a big round of applause for all of you. Fantastic. And the first 7 will get the books because there are 2 of them already have the books. Dr. Leena Bhagat and Dr. Mukesh Bhambre already have the books. So the rest of the 5 will get books. You all have the first 8. Sunita Manglik has the book, geriatric book. You have the first, Jehan, do you have the book? You also have the book. Hitesh doesn't have. So all of you who don't have the book in this list will get a book each. Wonderful. Now, एक और कंपटीशन बाकी है. नहीं, हम लोग वो कैलकुलेट नहीं किया है क्योंकि फिर एम्बैरेसिंग हो जाता है ना. बाकी लोग सोचते हैं कि मेरा किधर है नंबर. Okay, shall we? Yeah, close. Thank you so much. Okay.
The PDF when you discuss?
I have the PDF and they have the page numbers. Okay. Please reopen page number 28. Okay. Uh, First of all, question number 15 first. The brands Cremagel L and Enoblis contain calcium channel blockers and lignocaine. So Cremagel L contains diltiazem with lignocaine. Enoblis contains nifedipine with lignocaine. Calcium channel blockers are muscle relaxants, smooth muscle relaxants in this case, where they relax the fissure and therefore give pain relief when applied locally. Right? What are the other modes of therapy for anal fissures? Surgical, for example. And what do they do? What is that bath called? What is sitz bath? Sitz bath is only a warm water bath. Potassium permanganate is added by us as a tradition because हम लोग सीखते आए हैं. But just a simple warm water bath in a tub is considered a sitz bath and may be good enough. Okay, next. In which infection do you give azithromycin up to 500 mg BDS for 5 days depending on the body weight? Enteric fever is the correct answer. In what is the duration of therapy for PID? 500 BD? I don't think it is short, like 5 days. It can be 7 to 14 days. So here it is 5 days, but the response of fever will determine the duration of therapy. If azithromycin gives relief in 3 days, you will complete it at 5 days. If it gives relief in 5 days, you may give it for 2 more days. No, that is another part that is coming. Unlearning thoda sa duration of therapy mein karna hai. वो next है आएगा. Which 3 drugs are approved for uncomplicated cystitis in non-pregnant female? You got that right. Nitrofurantoin, phosphomycin. These 3 drugs are given for uncomplicated cystitis. How do you diagnose uncomplicated cystitis? Symptoms and urine routine. You don't do culture, you don't do sonography. Symptoms and urine routine are enough to, sometimes only symptoms are good enough to diagnose cystitis, which is in a non-pregnant female. Why we call non-pregnant? Why do we specify? Because in a pregnant female, you always need culture. That you must not forget of doing a culture in a pregnant female. Now, nitrofurantoin duration of therapy in this condition? 5 days. Cotrimoxazole duration of therapy? 3 days. Phosphomycin duration of therapy? 1 dose. So 5-3-1 is the regimen in uncomplicated cystitis. Next, what drugs are useful in atypical pneumonia? Atypical pneumonia is pneumonia which is not due to typical organisms. The typical organism for pneumonia, the classic one is pneumococcus. Then Haemophilus influenza is an organism. Klebsiella is an organism. Staphylococcus, Streptococcus are organisms for typical. Atypical, Mycoplasma, Legionella and Chlamydia are the classic 3 atypical organisms. These atypical have certain atypical features also. They are called atypical. Why? Because they don't have a cell wall. That's why they are called atypical. And they have classic atypical features also. Atypical pneumonia, they have patchy pneumonia. Infiltrates can be in both lungs. It's not a lobar consolidation like we see in pneumococcus. And they are walking pneumonias. Walking pneumonia. Matlab kya? Patient is usually not very toxic. Patient is walking about, doing work, and they have a patch in the lungs. They don't have a significant high fever. They may have low-grade fever. They may have normal WBC count. And they have a prolonged course, many days, several days, with cough and fever going on for a long time. That's atypical pneumonia. And in this, these antibiotics are considered the choice. Azithromycin amongst the macrolides, levofloxacin amongst the quinolones, and doxycycline amongst the tetracyclines. You should not combine 2 atypical drugs, but in a patient you are not sure whether it's typical or atypical, you can combine a typical drug like amoxicillin with an atypical drug like doxycycline. You can do that combination. 19 doses we will come to because I'm going to discuss this again. What are the drugs useful in anaerobic infections? You got that right. Metro, Clinda, amoxicillin are the classic anaerobic drugs. Anaerobic infections are classically divided into those above the diaphragm, those below diaphragm. In below the diaphragm, PID, for example, pelvic inflammatory disease can be anaerobic. Above the diaphragm, dental infection, aspiration pneumonia can be anaerobic. So the anaerobic above the diaphragm, amoxicillin preferred over metronidazole. Below the diaphragm, metronidazole preferred over amoxicillin. Clindamycin works for both. These are, I'm talking only orals. There are injectables also. But for outpatient orals, these are the three anaerobic antibiotics. Next, antimicrobial resistance, AMR, causes an estimated 5 million or 50 lakh deaths per year globally. This is a very sad situation, but that is going to only increase. Which oral antibiotics may be used to treat soft skin and soft tissue infections? Doxycycline, cotrimoxazole, linezolid, clindamycin. These are the 4 options for oral antibiotic therapy where you think that the patient has MRSA or if the patient grows MRSA. You know that patient of diabetes comes with cellulitis. Some cellulitis will have a break in skin. If there's a break in skin, there is an ooze, there is a discharge, you can culture that and it will maybe grow MRSA. And if you do not have a break in skin, then you have to presume MSSA in most patients. MSSA means methicillin sensitive Staphylococcus aureus. If you presume MSSA, then you can give penicillins or cephalosporins in the standard format, meaning you will give amoxicillin, for example, in these patients, 500 TDS for whatever days you like. But if there is pus which is discharging and you culture it and is MRSA, then you may have to give one of these 4 drugs. Okay, which 2 of these oral drugs are second generation cephalosporins? Now this is one of the weaker areas I think in family practice, knowing which cephalosporin to use where, right? First generation, second generation, third generation, then there are 4th and there is 5th also. I will give you on our group, I will give you basic information on cephalosporins because it's a long topic. But first generation covers predominantly gram positives. Third generation covers predominantly gram negatives. Second generation covers gram positives and gram negatives. This is the thumb rule. This is a general rule that you can follow when you choose an antibiotic. So for respiratory tract infection, what will work? First generation or second generation. Third generation which is gram negative, respiratory tract में gram negative नहीं होता. तो अपन cefixime use करते हैं कभी कभी. तो cefixime is a third generation cephalosporin. Should not be used in respiratory tract infection, but it is the most commonly abused drug in respiratory tract infection. Right? अगर skin and soft tissue infection है and you have to choose a cephalosporin, you will use first generation because it is gram positive. If there is an E. coli infection of the UTI, urinary tract, you will not use cephalexin, which is first generation. You will use second or third generation. Right? So, ये basic differences है. I will give more elaborate description on the group when we come to that. So, cefixime, you can write down on your sheets. Cefixime is third generation. Cephalexin is first generation. And cefuroxime, cefprozil are second generation. This is the correct answer is cefuroxime, cefprozil are second generation. Both are available in India. There are many which are available abroad and not available in India in all these 3 groups. Okay. Number 23. Which anti-inflammatory drug has received approval for secondary prevention of atherosclerotic cardiovascular disease? What is the meaning of secondary prevention? Patient को एक event हो गया, myocardial infarction, stroke, atherosclerotic event, and now the patient is, say, will be given aspirin, will be given statin, will be one new drug for this secondary prevention of ASCVD, surprisingly, is colchicine. We all know that inflammation plays an important role in rupture of a plaque causing a event. Now, and this inflammation can be reduced or prevented if you give anti-inflammatory. Both azithromycin and colchicine have been tested as anti-inflammatory drugs. Colchicine has received approval, and how do you decide that patient को inflammatory process चल रहा है? By doing what is called as high sensitivity CRP, HSCRP. So one recommendation now, which even I have not started yet following, is every patient with a stroke, myocardial infarction or an event, you do an HSCRP in every such patient, and if HSCRP is 2 or more, you start colchicine. Very cheap drug. So I'm surprised that a very cheap drug has received such a great trial, right? Because usually pharma companies would be interested in this. Lifelong duration of colchicine as a secondary. It's like aspirin, a secondary prevention drug for life. Sorry, come. She's asking if HSCRP is more than 2 in a routine checkup, don't give. You have to have secondary prevention. Remember, patient has to have an event after which you can give. Sorry? Stroke. All what is ASCVD? Atherosclerotic cardiovascular disease includes stroke, ischemic stroke, not hemorrhagic stroke. Ischemic stroke, heart attack meaning ischemic heart disease, peripheral vascular disease, and renal artery atherosclerotic stenosis. All these are included in ASCVD. Okay, next please. Next please. 24. 2.5 BD orally, starting 12 to 24 hours after surgery and continuing for up to 14 days in TKR and up to 38 days in THR. THR means total hip replacement. Apixaban. Now, there are NOACs yet. There are 4 NOACs that are probably available in India. Endoxaban available either? I'm not sure. But rivaroxaban, apixaban, and dabigatran are 3 NOACs available. NOAC stands for what? Newer oral anticoagulants. Newer N का newer है, को novel भी बोलते हैं, कोई non vitamin K dependent भी बोलते हैं. तो N के बहुत सारे full forms हैं. But NOAC are generally newer oral anticoagulants. NOAC का फायदा क्या है? वॉरफरिन में डाइट कंट्रोल होता है. ये पालक नहीं खाना, पालक खाना तो रोज सेम खाना. ओके, वो डाइट कंट्रोल्स NOACs में नहीं है. वॉरफरिन देते हैं तो पीटी INR बार बार करना पड़ता है. NOACs में जरूरत नहीं है. NOACs का डिसएडवांटेज क्या है? दे आर एक्सपेंसिव एंड सेकेंडली they have indications which are not all that are available for warfarin. For NOACs are not useful in valvular atrial fibrillation. Not studied, they will become probably studied better, but valvular atrial fibrillation, NOACs are not given. Non-valvular atrial fibrillation, established DVT, prophylaxis of DVT, DVT with pulmonary embolism, NOACs are used. So NOACs ka apna OPD for general practitioners, one thing important is to remember that DVT is common after TKR and THR. Embolism is common after TKR and THR. All our patients who are going for TKR or THR, do take care to kind of remind the surgeon or the patient that if the patient especially is high risk category, very obese, elderly, with comorbidities, you please tell the orthopedic surgeon, can we give NOACs after we have operated. So you know the dose there. The next dose that we must know as family physicians is the dose in uncomplicated deep vein thrombosis. Question number 25. Apixaban 10 BD for first 7 days and then 5 BD for up to 6 months, usually 3 months, is the dose in uncomplicated DVT. How does a patient present to you? The classic presentation is patient has had a long journey by road from Ahmedabad to Mumbai. Patient has pain in the calf, swelling in the calf. You check the calf, there is tenderness in the calf. You do a Doppler, there is deep vein thrombosis in the calf veins. Now you should realize that if the patient is uncomplicated, meaning the patient has not had pulmonary embolism, then you can treat this patient at home. You can treat this patient without referral, and it is a simple treatment of this regimen of apixaban. Apixaban, brand name, any brand names? Eliquis, for example, which is the original brand, which is expensive. Alixaban, for example, is a cheaper brand. There are multiple Indian brands have come which are not as expensive as Eliquis. So 10 milligram BD, 7 days loading dose, and then 5 milligram BD for 3 months, maybe up to 6 months. In stroke prevention, in atrial fibrillation, non-valvular atrial fibrillation, in stroke prevention, if the patient has chronic AF, for example, or recurrent AF, you have to give lifelong therapy, not 3 to 6 months. You have to give lifelong therapy with apixaban. Next question. In a patient receiving bempedoic acid, chlorthalidone, and low-dose aspirin, you can have hyperuricemia. All these three drugs cause hyperuricemia. Why I put them together? Because all three are cardiac drugs. All three may be present in one patient. Low-dose aspirin causes hyperuricemia. High-dose aspirin causes hypouricemia, paradoxically. So, low-dose aspirin बहुत लोगों को मिलता है आफ्टर ASCVD, उनको क्लोरथाइडोन भी मिलता होगा फॉर हाइपरटेंशन. एंड अगर स्टैटिन टॉलरेट नहीं किया और आपने बेम्पेडोइक एसिड दिया तो यू हैव नाउ हैव अ ट्रिपल वैमी एंड यू हैव टू मॉनिटर यूरिक एसिड. Next, ARNI, beta blockers, SGLT2 and MRA are four pharmacotherapy pillars of heart failure. Now, heart failure of which variety is more responsive to these? There are two heart failures, HFrEF, HFpEF. So, those with reduced ejection fraction have a greater role. These drugs have a greater role. I'll just brief those who are not sure of the terminology. HFpEF, HF small p EF, HFpEF, heart failure with preserved ejection fraction. Preserved would be defined as 50% or more ejection fraction. HFpEF. Why does HFpEF occur? We used to call it diastolic heart failure. It chiefly occurs in patients who have hypertrophy of the left ventricle causing poor diastole. So that filling is less and there is back pressure due to poor distension of the LVA. HFpEF typically occurs due to age, due to chronic hypertension, and due to obesity. These are three precipitants of HFpEF: age, obesity, and hypertension. HFrEF, on the other hand, heart failure with reduced ejection fraction, is typically, classically, with after myocardial infarctions, where you have akinesia or hypokinesia of some segments. HFrEF, of course, can also occur in dilated cardiomyopathy, reduced ejection fraction. These drugs, the four pillars, are more useful in HFrEF than in HFpEF. SGLT2 inhibitors, dapagliflozin, empagliflozin, canagliflozin, can be used in HFrEF even if the patient is not a diabetic. That is very important to realize. You don't need diabetes to give SGLT2 inhibitors. Just HFrEF is enough. Okay. Last, cilostazol, pentoxifylline, aspirin, and statin are the four drugs considered useful in what? Intermittent claudication. What is the meaning of what is the cause of intermittent claudication? Peripheral vascular disease. Claudication means pain in the lower limbs or limbs due to decreased blood supply. Intermittent means these patients usually have pain while they walk, not when they are stationary. Intermittent claudication due to peripheral vascular disease, say for example in smokers, these are drugs often used. Cilostazol is a drug that is classically used, pentoxifylline, classically used in this peripheral vascular disease. They are not used in coronary artery disease, renal artery disease. Occasionally cilostazol is used in strokes, after strokes, but typically peripheral vascular disease. Okay, that is the end. We are taking a break here. Just one feedback that I receive, I need to get is this format a decent format for general learning? Yeah, and as we have already started, I had started a similar thing on the group. If you remember, we have given MCQs of 2 choices after pictures or images, etc. So I am going to continue the pharmacotherapy teaching on our group, which is there right now, for some more time until you get bored. For some more time, how will I know you are getting bored? You will start exiting. Yeah, so once you start exiting, I'll reduce. But otherwise, till then, maybe a few times a week, Kumar principally prepares a lot of questions. So we'll give one applause for Kumar. Brilliant research. क्या बोलते हैं indefatigable means उसको थकान ही नहीं होता. आज सुबह, you will not believe, आज सुबह 7 बजे I messaged him, I want this topic to be prepared. He prepared 1 hour before he came here. We have a topic prepared, which we'll be doing now. So yeah, break for 15 minutes maybe. There are snacks available. You have a question? Sorry, just a moment. So he's asking, will HFrEF may SGLT2 cause hypoglycemia? Unlikely that they will cause hypoglycemia. You don't need to monitor. Symptomatically you will decide. Sorry? HFpEF, SGLT2 have started receiving approval, but the efficacy is probably not the same as in HFrEF.